Hello, everybody. I'm trying yet another um, method of recording in order to hopefully make this better. And I'm also trying to talk louder. I'm having issues with Kaiser Permanente HMO, Health Maintenance Organization. I've been with them for 35 years, I think. Um, I pay about $900 a month for that benefit. And I'm really getting tired of it. And I'll tell you why. There are a few problems. One is interaction with some of the people who work there. And another is my primary problem, which is with the bureaucracy. I had a gastric bypass a number of years ago, 5 years ago. And in that time, I've had a few run ins with nurses and doctors that sort of speak to the biases we have toward big people and the problems we have. Um, Probably the primary one is the supposition about you and your health. I When I go in to have blood taken from a phlebotomist, they quite often will look at me and think, "Oh, thin person or thinner person." I certainly am not slender. And they will talk to me like I'm an equal. And suddenly they start rolling up my sleeve and they see that I have a lot of excess skin on my upper arm. And I once actually had a phlebotomist say to me, "Oh, well, I see what the problem is." And I looked at her and I said, "What problem? Did you mean the fact my sleeve won't go up?" And I said, "If that's the problem, I'll just take my sweater off." And she, "No, no, no. I didn't mean it was a problem," which of course she did mean. And she made various comments along the way. And so I just sighed and put up with it. Another time, after I broke my other hip, I've broken both my hips now. I was in the hospital. And again, the nurse was talking to me like I was an equal. And I was talking to her because I thought I was an equal. And then she uncovered my hips to help me swing off the bed and go walk with the physical therapist. She looks at me with terror in her eyes and she says, "Well, we're going to have to get a big, uh, a a bariatric wheelchair." And I said, "I have a walker. I walk by myself." So I know anybody who's gone through this knows what I'm talking about. It's the attitude you get. And I don't need to feel inferior. I've already been made to feel that way by the system. And trust me, people who have a weight issue have dealt with it all our lives. I've been heavy since I was 2, 3 years old, something like that. And so, what can I say but shut up? We know. You don't need to tell us. It's not like we've suddenly had a bariatric surgery and suddenly we feel like we're the same as you. We are, by the way, but we know you don't think that. Now, that's the behavioral end of things with, and nurses are very seldom the problem at Kaiser. I've had more problems with doctors there than I have anywhere. The one gynecologist who uh, gave me a face that says, "You don't know how disgusting it is for me to do a pap smear on a woman of your size." And I got up and left the room. It happens all the time. Ask anyone who's large, they'll tell you. So, anyway, the main problem has been I broke my right hip through exercise. I was exercising and I had a very bad right hip because of so many years of being heavy. And I had been exercising and I broke it. I went to have it x rayed, and they told me, well, you need to have a complete hip replacement. I said, fine. So then they told me I had to lose 200 pounds. So I said, okay. So I proceeded to do that. Before they were able to get me in for surgery, I had lost 200 pounds. I had about 70 more pounds to go. So I went in and had a gastric bypass done, and I lost 60 more. So I went in, I had my right hip replacement done, and I was fine. I came back 100%. I was doing great. I was walking on a cane. I was able to walk as much as I wanted to. Then one day I'm in the bedroom and I'm hanging up clothing. And because I had a gastric bypass, which depletes your bones of calcium and makes them porous, I fell backward, hit my left hip, and heard crunch. Anybody who's had that happen knows how wondrous that is. So I had to go in. Now, suffice to say, after all this time, it's been 2 years. We went through COVID. I regained 50 pounds. Now, my health is good. I take my medication, I do what I'm supposed to do, but I've regained some weight. And a lot of people did during COVID because we were all stuck at home. That I had a broken hip. Now they patched it together enough so that it'll hold together, but I couldn't get a complete replacement done. So I am trying to lose weight. And when you can't exercise, it's very difficult to do. So I am still in the bottom rungs of weight um, regain of many of the people in the Kaiser weight program I was in when I had my bypass done, my gastric bypass. So I was told I still had to lose that 50 pounds to get back and have my left hip replacement done. So I said, okay, fine. How about giving me some of the injections that I'm borderline diabetic, by the way. And my brother is diabetic. My little sister was diabetic. She passed away. My niece is diabetic. My nephew has just been diagnosed. And it runs in my family. So I said, can I have any of the various injectables? And I'm told, well, first you have to take some metformin. And I said, is that going to do anything? And my doctor had to admit that no, probably it wouldn't. But I had to wait 3 months and try. Now, it's not enough, apparently, that I did lose 260 pounds. It's just I'm not a good girl. I'm not a thin girl. So I can't have the injectables. So I said, yeah, I'm not doing that. Just not doing it. I want the injectables. Everybody I know who's had these issues has gotten them. And I can't have them because, if you want me to leave Kaiser, I can do that and pay $900 a month somewhere. I'm sure I can get them. And I said, oh, no, no, it's fine. We just have to go through this hoop first. So I said, no, I'm not doing it. So I called up Kaiser. I called up and talked to their little friendly case manager. And I was told they have to ask both sides of this. Now I thought maybe I'll just go over and get my left hip replaced without worrying about, my health is good. So why not just have the surgery? Well, no, I'm told I have to lose the weight first. Now keep in mind, I know two women my age who've had both hips replaced who are bigger than I am. But because we're dealing with Kaiser's backward nonsense, I'm having to do this. Now, I know any of you who have Kaiser know the problems we have to go through. And I said, I'm happy to pay for the medication. You want me to pay $150 a month? I'll do it. And they said, no, we have to go through this hoop first. So I couldn't get my hip replaced. I couldn't do any of this until I lose 50 pounds. But they won't let me have the injectables. I had to take pills because I'm a naughty girl. So suffice to say, I called up and I told them that I'm not doing any. I either want my hip replacement, God damn it, or I want the injectables. If they just give me my hip replacement, if it's okayed by my doctor, I'm not trying to go against my doctor's advice. I'm talking about the bureaucracy. If I'm okayed for hip replacement, then I'll just go and have that, and I'll walk every day and lose the 60 pounds or 50 pounds and some more on top of it. So anyway, that's the problem I'm having. Hopefully, I'll hear back from Kaiser within 3 weeks. I'm supposed to. And I'll let you all know what I've heard. My case manager is named Jason. And I'm here in Lancaster, California. I'm a patient of Dr. Uy, and I'm at the Butterfly Building and Main 15th Street West Lancaster building. So I'd love to hear from anybody who's had similar problems. We need to start kicking them in the ass and letting them know that lots of people get this. I'm borderline diabetic, and I have lots of diabetics in my family. So I think I should be able to receive the medication. And I certainly needed to lose to have my hip replaced. Now tell me what's more helpful. Me waiting another 6 months until I can jump through the hoop with the metformin and finally get my hip replaced, or just getting my hip replaced and be able to be healthful and active and exercise, swim every day like I used to. You let me know. Thank you for listening to all this. Tomorrow I'm going to talk about something else. You have a great week.